Good evening. It's a virus which kills more babies globally than any other. Only malaria kills more children than the respiratory virus RSV. Now, pregnant women receiving antenatal care at the John Radcliffe Hospital in Oxford are taking part in a world-first clinical trial to help develop a vaccine. Matt Raveling reports.
Could this finally be the breakthrough to help protect children just like Lucy? 4 weeks after she was born, Lucy developed a cough. Her older sister Ellie had a cold, so her mum wasn't overly worried, but took her to hospital as a precaution.
The consultant, even, and one of her top regs spent about 20 minutes trying to get an IV line into her hand. Throughout all of that poking and prodding, she wasn't responding, she wasn't crying, her eyes were open and she was looking around, but she wasn't really engaging with what was going on or responding to pain. So I think at that point it dawned on me that actually I wasn't being a neurotic mother and she was actually quite ill.
Like 2/3 of babies, Lucy had contracted respiratory syncytial virus, or RSV. The condition can be fatal. Many babies develop a cough or a runny nose, but for 1 in 6 it means a visit to hospital. In severe cases it can cause bronchiolitis, a condition which causes air passages in the lungs to swell. But now staff at the John Radcliffe Hospital in Oxford hope to make stories like Lucy's a thing of the past.
Every October and November we just see enormous numbers of babies presenting to the hospital and the emergency department, or being admitted to the ward, or even to the intensive care unit with RSV. And if we could prevent this, it would make an enormous difference to the health of children in this country.
The hospital is taking part in a global study. A selection of healthy pregnant women planning a winter birth will be offered an RSV vaccination injection. As well as mums-to-be, babies and infants will also help to make up more than 2,000 participants in Oxfordshire over the coming years.
While there are lots of other things you might be looking out for which you can think could end up being serious for your child, that this is one of the most serious things that can happen with young children, happens so commonly and yet so few people know about it, I guess was surprising.
Trials are expected to start next month, and it's hoped the results will help the next generation to build up a better defence against RSV. Matt Raveling, BBC South Today.